following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm Shay Paul, and I am being joined by my friend, Dr. Chapman of Living Well. Dr. Chapman, how are you?
I'm great.
Good. You look wonderful, as always. Nice and refreshed. We're going to talk today, we're going to have a conversation about tattoo removal. I know I actually have some friends who have, done things or gotten tattoos when maybe they were younger, now for various reasons, whether it's because of their career choice, they may want to remove it. You do that there at Living Well, correct?
Correct. We use the PicoWay Tattoo Removal System, which is one of the #1 tattoo removal systems in the entire world. We have here in the Charleston-Huntington area. And so we're very proud to have that. It's a simple procedure. The patient comes in. We can actually remove full color. So all the spectrums of the color and, of course, black. Black is the easiest to remove. But they usually come in, we do an evaluation of the skin and the tattoo, and then price is determined on size.
Okay.
So that's why we really need a consult with the tattoo removal patient, because we need to see how large the tattoo is or how small it is. We never can tell how many treatments it will take looking at a tattoo. There's a lot of things that factor into that. What kind of ink was used,
right,
what depth the ink was placed in the skin, how long the tattoo has been in the skin. So all of those things play into, and then the person's own immune system, because actually the way the tattoo removal laser works is it creates an irritation and fragmentation of the ink molecules. So we irritate that tattoo and break up the ink molecules into very small particles. And then the body's own immune system comes in and chews up all of that, what we call ink debris, and removes it from the body. So it's difficult to say how many times it's going to take to remove a tattoo completely because it has so many factors to it, but this laser is exceptional at doing that.
Okay, so I have a question. So would you say that maybe someone with a compromised or suppressed immune system may need more treatments? Is that what you're saying? Possibly?
It most likely would take a few more treatments.
Okay.
Exactly. But it doesn't mean that it won't work.
Right.
It still works. It just may take longer. And I just try to stress that with clients coming in, patients coming in, wanting a tattoo removed. I'm like, this is a process. It's not like some of the other things we do, like Botox and fillers that are instant results.
Right.
You gotta go on a journey to get this off of you.
Gotcha.
And the main things we remove are names, of course, and we remove a lot of people have had rings tattooed on the ring finger. Yeah, mother. Birth dates, things like that are just not maybe the patient wants on them anymore due to changes in life. But and like I said, a lot of times we'll have rings. A lot of patients come in to have rings removed that have been tattooed on the ring finger. So it works very effectively. It's a great system in that it minimizes risk of scarring. So that's a great thing too. There can always be something called ghosting that occurs when a tattoo is removed, meaning it leaves like a faint white area on the skin. We talk to patients about that could happen. But this system really tries to minimize it because it's more using acoustic energy than it is heat energy to do this process. The Pico technology, the laser fires so rapidly and so intensely that it shatters the molecule based on the acoustic energy coming off of the wave that hits the skin. So you have to use lower energy.
I'm sorry to interrupt. On a pain scale of 1 to 10, what would you say?
So I would say this is probably about a 5 to 6.
Okay.
We do have some awesome numbing cream now that we use that can cut down on the uncomfortableness of it. But it is one of the more uncomfortable things that we probably do at Living Well. But we get you through it. And the thing of it is the Pico system is so fast that you can do a tattoo that's a the size of an index card. Let's just give the audience an idea. The size of an index card, you could treat that in probably about 2 minutes or less.
Okay.
So it's very quick
Pretty
and
quick.
get them through it quick.